Hi everyone, welcome back to Renegade Healer. It's been a long time, it's been several months since I posted anything, and I apologize to anybody who'd been kind of wishing or wanting to follow and have more. It's just the pace I'm at these days. Today I actually want to talk about something that I've wanted to talk about for a couple of years because it really started for me in my work experience more so than my personal experience. But in my personal experience, it's become even more something I'm passionate about. And it's about just generally navigating the healthcare system, but also understanding our role in the healthcare system and how critical it is, particularly right now. So this might be a little bit longer than normal, and also it may not be what people are expecting because it's really got little to nothing to do with my own journey of health or brain injury, but it has a lot to do with everybody's experience in the healthcare system and our responsibilities. So I'm really hoping that people will take an interest and bear with me and maybe even share it because this is important. So the first thing is basically I want to give people the lay of the land. So I speak from my personal experiences, which is in Ontario, and of course across Ontario things are going to be slightly different here and there, and across Canada things are going to be slightly different. But in general, all across North America and even further abroad, our healthcare systems are experiencing some very similar phenomenon, and a lot of that is actually kind of a mini history lesson. It's birth rates, historical birth rates, and it's the baby boomer generation. What is happening right now is that our baby boomers, our aging population, are sort of all hitting the healthcare system. The needs, their needs have come to a point where they have additional supports required medically, in terms of independent living, around the same time. But we knew this would come, and we knew it was coming. We've known for a long time, but nobody could really anticipate exactly when or how hard-hitting it would be or what the needs would be at the time. So regardless, let me just say this isn't about pointing fingers or placing blame. This is just about recognizing reality, okay? So you'll hear expressions like the gray wave, or recently I heard somebody say the silver tsunami, which kind of I thought was good. But basically, yeah, I mean, there's this generation of aging persons who are coming into our healthcare system with a lot of needs, and they're coming harder and faster than expected. Because our healthcare system is already fairly taxed in terms of demand, it's very, very difficult to come up with creative solutions to meeting all these needs. So one of the reasons why this is so important is because we tend to have kind of an expectation. I always talk about the triangle, and I always learned the triangle is something that you think about with home improvements, actually, where you can only have two sides of the triangle at any given time. You can't have three sides of the triangle. The three sides are speed, fast, cost, cheap, and quality. So that's a really good kind of equation, so to speak, because it helps you kind of recognize that there's always going to be a trade-off. You can have it fast and you can have it cheap, but you might sacrifice quality. You can have it really, really well done and at a decent price, but it's going to take a long time. You get the idea. In healthcare, we have kind of grown up with this expectations, especially here in Canada where our healthcare is free. We think we are not just supposed to get, but are entitled to all three sides of the triangle. And not just good price, but free. in addition to that, we sort of have adopted this customer's always right kind of attitude where we treat our doctors kind of like the pit crew in a race where, we drive the crap out of the car or our body and bring it in, and they just are supposed to do this rapid pit stop and fix everything and make it great, and we're supposed to be able to get out there and keep going. And we don't necessarily always treat people well, and we sort of don't give them space to be human. But that's not healthy for any of us, because that's not the system that exists for us. It's not what's available to us. And these are human beings, and they are under a tremendous amount of pressure, and they can't work miracles. So we really need to understand this so that we can sort of, one, adjust our expectations. So as we move through the system, we aren't constantly frustrated, surprised, and disappointed. And also so that we can better preserve the health and integrity of the people who are providing these services to us. Because, to be honest, I'm really worried. And if you spend a little bit of time researching, you'll find that a lot of people are really worried about the health and well-being, the mental health and well-being of a great many people in our healthcare system for this reason. So we need to all take responsibility of that, not even necessarily because we're, community-minded. You can be your own person. You don't have to be kind of a socialist or a social worky type, but for your own self-preservation. You get the best quality of care from people who are healthy, relaxed, and happy. Sorry about that. Okay, so why am I saying all this? Because I wanted to give the lay of the land. Okay, so that's kind of the starting point. There's another piece as well, which is we tend to expect our healthcare system to run like a system. We expect excellent communication, flow of information, follow through. We have always gone with this no news is good news approach, where we expect our doctor's office to call us if there's any problems. We expect our doctor's offices to track and remind us when we're supposed to have a physical, whatever. On and on it goes. That's, again, it's expecting too much. And it's not because people aren't trying or they don't care. It's because they are really just trying to keep up with the day-to-day needs, emergent needs of the people who are coming in to see them. So we, in addition to kind of knowing the environment that we're navigating, we also need to know that there's more responsibility on us. We need to take responsibility for being our own kind of healthcare quarterback. So that's the starting point. Where does that? How does that play out? I guess would be the next piece that I want to kind of articulate for you, because to me it really helps to understand the sum of the impact or the situation. Okay, so think about your typical kind of hospital experience, or what you would expect from what we've all grown up with. You're ill. Maybe you've had a serious episode of a heart attack, a stroke, something like that, fall. So you go to hospital. You're admitted to hospital. You're cared for a period of time. What used to happen, and what a lot of people still believe should be happening, is that you would stay in the hospital until you have fully recovered to the point where you can go home to, modest adaptations and complete your recovery there, move on. Now what we find is that the hospitals are not able to keep people as long in hospital because they need the space. They need the beds for other people more emergent, more sick to take those spaces. So people are being discharged from hospital earlier. The other thing is that people who probably should be in long-term care, or what we would think of as nursing care, aren't able to get spaces in those facilities, but are not able to move home. So they are staying in hospital longer, and or also being moved to facilities where they aren't really getting their needs met, like more like retirement homes. So we have this kind of started this kind of, I call it a backlog, or a kind of a trickle down, where people are getting left in situations where their needs are not really being met to their expectation or satisfaction. So you get people that are at home who should be in hospital, and we try to supplement their needs with in-community care. So people are familiar with community nursing, wound care, that kind of thing. People who come and visit you in your home. So that's how we try to supplement their care, which is amazing. But there is another tier of people who, for the most part, are doing okay, but they don't need hospitalization, but they do need some help in order to stay well and stay in their home. And because that community care is being dedicated to people who should be in hospital, the help for those other people, a little bit more independent, who just need that, it's not actually really freely available. So what happens is that those people are not able to keep up as well. They become more fatigued. They're more prone to have injuries, illness, burnout, whatever. And then again, people who, just have maybe a short-term need for a little bit of additional care, a little bit of support, they may or may not be able to get that either, because all of the support is kind of overburdened. This affects everybody, because again, it's that access to the care when you need it, when you thought it was going to be there, that expectation, that disappointment. It's also about the concern over the welfare and the quality of care for your loved one. But it also should be for your own quality of care, because when you do go into the healthcare system, you are encountering people who have been working at this pace continuously, and there's no end in sight. So we need to do a couple of things. We need to think about how we're going to manage differently for ourselves, and we need to think about how we can be more proactive and involved in helping change this situation. Okay, so for yourself, there's a bit of repetition here because I've said it before. You really need to get yourself a little diary, a little notebook of some sort, a journal, and start writing things down. Start writing down and tracking your own symptoms so that you can have really efficient and effective conversations. Start writing down the advice that you're given by doctors and healthcare professionals so that you can be more efficient in following through on that advice, so that you are taking as much personal responsibility for your own health and well-being as you can. When you move through the system for any reason, tests, an ER visit, whatever the case may be, write down the names of the doctors you encounter, the tests that are ordered, and the date and what facility you are at. Any information that you can, try to remember to write it down, or ask that it be written down, and just tuck that leaf of paper into your journal so that you can then be responsible for following up. A couple of really good bits of advice would be, one, try to always give the name of your healthcare provider if you have one, a primary care like your own doctor. Try to give that name and ask that copies of your test results be sent to that person as well, because generally test results are only sent to the person who ordered the test. And then when you do see your own caregiver, ask them if they've received the reports and ask them if there's anything that needs to discuss. That's really important, because that assumption that no news is good news is it leaves you exposed to risk of having something missed. It is very normal and natural human error to miss a test result, forget to talk about something, and the system, as taxed as it is, it doesn't flow quickly. So, even if information is flowing well from one facility to a next, it may not come in a timely fashion for your appointment. So there could be really large gaps. So it's always good to instigate good conversation. Okay. We also need to be changing the way that we interact with the people we encounter. We need to be more grateful, which is really hard to do when you're not well, when you are sitting waiting in a waiting room for hours and hours, when you call for an appointment and you have to wait weeks and weeks, or you're really sick and somebody's made some sort of mistake with your prescription. Those are all really, really hard things to navigate, but we have to start looking out for our caregivers. And if we continue to mount more and more pressure on them by holding them to these high expectations and being unforgiving and sometimes even abusive, we have to admit that there are times when, as patients, we are harsh. And we've been led to believe over the years that that's okay. You're in pain, it's understandable. And of course, to some degree it is, but that doesn't mean it's okay. And by forgiving ourselves over and over and creating a habit of mistreating our caregivers, we're making life harder on everybody. So we have to start just interacting differently. And it starts with just saying thank you and saying that's okay. If a mistake is made, I understand. What can we do to get this back on track? What could I be doing to help make sure this doesn't happen in the future? How can I be proactive? We also need to be willing to pay, those of us who can, whether it be that we buy our own assistive devices or pay to travel to a clinic that's not as busy. If we're able to do something that will clear some of the backlog and allow access to other people or take the pressure off a local clinic, we need to be willing to do that. We also need to be planning ahead. We need to have conversations, awkward conversations that we don't want to have with our loved ones about future planning and about making sacrifices now so that we can save and plan for care needs in the future. And you know what? If you get there down the road and you don't need it and that money's sitting there, somebody else can use it. They can enjoy it. They can use it for their own security. You can donate it somewhere. Planning ahead is smart and healthy, and you will have a much better quality of life, and you will reduce a lot of stress on yourself and your loved ones and the health system. There's another piece, and it sounds old-fashioned and it sounds kind of hippie-ish, I guess, but we need to start participating more like a community amongst ourselves. And I'll give you a really simple example. So a few minutes ago I was talking about people who are at home but not necessarily getting quite enough support to really manage well at home. So what happens? I'll give you a very typical scenario is maybe an elderly person living at home alone. It's winter time. They go to take out their garbage. They slip, they fall, they bruise or crack or break a bone. Let's say a leg or a hip. So now that person is entering into the health system. They're exposed to a lot of virus and infection, so just flus and infection. They don't heal as quickly. They come home more weak. Mobility is reduced. So those simple falls can be highly, highly problematic and throw somebody who was otherwise relatively independent into being quite needy and involved in the healthcare system. If one of us notices a neighbor, an older person, and starts bringing their garbage down for them, maybe your kids becomes their chore, walking the dog for a neighbor who's a little unsteady on their feet in the winter, or at all in general. Bringing soup, bringing leftover or an extra portion of meals to a neighbor to make sure that they're eating well. If they're living on their own. These are all things that seem really simple, but they have a huge impact and keep people in their homes longer and keep people well, keep people out of the healthcare system, which is good for everybody. And we've stopped doing them. A lot of people we care, but we just don't think to do it anymore. And we need to get back to that. There's an additional piece to that as well, which is that every time we interact with one another, we're creating a stronger sense of community, which is also preventative in terms of our health and maintaining health. And it also makes us a little more free and willing to ask each other for help with slightly bigger things. And this is also important, and this is still about healthcare. Because, example, you have a fence to put up. You can do it on your own. It'll probably take you the weekend, maybe even longer. Your neighbor offers to come and help you. It's probably going to take a few hours. In that time, you are socializing, you're out, you're getting fresh air, you're exchanging, you're having conversation, you're building a relationship. Next, you're under less stress, you're under less strain, you have a little bit of time to do some other things, maybe spend some time with your family, whatever. Your neighbor then, the next time they have a big project, comes and says to you, would you mind helping? Same thing happens, same result for your neighbor. So here we are, this society of people who are running like mad, busy, trying to keep up with the demands of our jobs, the demands of our family, the financial commitments we've made, and we just feel like there's not enough time for anything, including helping each other. But the truth is, by helping each other, we actually create time and connection. We reduce the stress. We create opportunities for just social connection, which even reduces the stress further. We become just a generally happier, healthier, more interconnected community. We save each other money. I mean, it just keeps going on, and I could go on about this for a really long time. When I talk to my husband, I call it true social economics, real social economics, the currency of community. And the reality is that every time that we do anything to help one another, to interact, to support in any way, we aren't just doing good for one another, we're also doing good for our community, ourselves, our healthcare system, and ultimately our economy, which just sounds like an exaggeration, but it really, really isn't. Okay, I'm going to wrap this up. I know a lot of people, if they take the time to watch this, will be thinking, healthcare system, not my problem. Healthcare system, tons of money, government, let somebody, they've got to figure this out, they've got to fix it. But the healthcare system is under siege right now. You cannot ask a group of people who are in the throes of some sort of an emergency to stop and figure out how to change the trajectory. They just have to cope. They just have to do the best they can and try to keep going. And yes, there's tiers to the government that are working towards system changes, but it's human dynamics. It's slow moving and it's muddled and confusing, and there's some really amazing work going on, but it's not happening fast enough to be effective right now. So we have to realize that the system is just a bunch of human beings, and all they're doing is trying to follow the rules, the regulations, the procedures, everything that's been set out for them and set out before them, by using the equipment and resources that have been made available to them by other human beings. The system is just a bunch of people, and we're part of it. We're a huge part of it, and we will affect it with our choices, our decisions, our behavior, and we can best affected. I'm never going to say stay out of it if you don't need to be there, but keep yourself out of it as best you can by being healthy, taking good care, taking care of the people around you. And when you do have to be in the system, be a part of the team. Be a grateful, thankful, a supportive, understanding teammate in the process of being well, and view the people that are supporting you as the helpers that they really are, so that they'll stay in the system and they'll have the energy to keep going. So I hope that this is meaningful for some people. It means a lot to me. So thanks for watching. Take care.